Aesthetics. I'm Matt with ACA, and joining us once again is Dr. Thomas Pane, Chief Medical Officer of Atlantic Coast Aesthetics. And Dr. Pane, this week, our question comes from our Facebook audience, and a person has a question. Apparently, their weight has fluctuated over the years. For a flat stomach, should they go for a liposuction or tummy tuck? Dr. Pane, what do you recommend?
Well, the question of whether someone should do a tummy tuck or liposuction, is an age-old classic in plastic surgery. There's no exact perfect answer. It depends on a few factors, like many of these situations. So if the weight has been up and down, that implies that the skin may be a little loose, as it often is. Again, we need to know the person's age, whether they've had kids, are they planning to have kids, and where are they with their weight? Is it up and down historically, or is it up and down now? Because I usually don't recommend anything until you're kind of stable where you want to be. Similarly, if you gained and lost some weight, skin's a little loose, but you're planning to have kids next year, that may not be the best time to do anything. So I'll give you a couple of different situations, and here's the best answer in each one of these. If the person's at a relatively stable weight, they have tight skin, maybe they're done having kids and the belly's already pretty flat, but it's really just pinchable fat under the skin, then those people are going to be better off with liposuction. Also, if they want to transfer that fat somewhere, like to the buttocks, which is super common here in South Florida, maybe not as common elsewhere in the country. But if you're going to do that procedure, you think about it, I want to do that usually when it's your first time having lipo. So if that's a consideration, then it's more on the lipo side of the equation. If the skin is loose, there's a lot of stretch marks, you've had some kids, the weight's been up and down, I'm more interested in a tummy tuck there because you're going to get a flatter abdomen. If you do liposuction in that case, what you pinch does get reduced. And again, it doesn't involve a big scar. But that liposuction would only be good in those kind of candidates if they really don't want any scars and they're mostly concerned about how their abdomen looks in clothes. They want the abdomen to be flat outside of clothes, they're going to be better off with a tummy tuck. And again, if they have a big round abdomen because a lot of intra-abdominal fat, then liposuction isn't going to be great for them either. Tummy tuck's not perfect for them, but it will address the extra skin on the lower part of the abdomen. And again, if the weight has been up and down or there's a need to lose a lot of weight, keep in mind neither of these procedures is good for weight loss. They're just not designed for that. Weight loss is diet and exercise, all the those efforts to try to get to a stable weight, or for people that are candidates, bariatric surgery. What's commonly done now is the gastric sleeve is more common than the lap bands and some other things that were done in the past. If somebody is thinking of doing that for weight loss, I recommend get that out of the way first. Most of those people are going to be more to the tummy tuck side because they're going to have more likely to have a lot of loose skin. Not in every case, but in most. So again, that's pretty much the overview of the liposuction versus tummy tuck situation and how weight loss and what your future plans play into it in terms of selecting what to do and when to do it. In our practice, we do all of this, so it's just a matter of picking the right thing for you. We don't need to put you into one category or another because we do all of it. It's just a matter of what you want to do, what your goals are, and what you're starting from. So I hope that explains it well, and we'll talk to them next time.
Well, thank you, Dr. Pane. We appreciate your time. And if you have a question for the doctor, please visit our Facebook page, website, Instagram, Twitter, or YouTube channel. And Dr. Pane, we'll see you on the next one.
Great.